Assalamu alaikum warahmatullahi wabarakatuh. Today we are going to discuss a case of vitiligo, Station 5 in MRCP business exam. As you know, Station 5 is 10 minutes, 8 minutes with the patient, and 2 minutes with the examiner for discussion about the case. How to approach a case of Station 5? Station 5, we know it is focused history, focused examination, and to reply the patient concern. The case of vitiligo in the exam is very frequent and is a common case in the exam. It can come in multiple scenarios in the form of skin rash and fatigue, skin rash and dizziness, skin rash and loss of weight, skin rash and loss of consciousness. Of course, here he don't want you to diagnose a case of vitiligo. Anyone can diagnose a case of vitiligo by inspection, but he wants you to explore the other autoimmune diseases associated with vitiligo. So if he brought a scenario of skin rash and fatigue, for example, so you have to think about this fatigue may be due to other associated disease, autoimmune disease like hypothyroidism, Addison disease, diabetes mellitus, celiac disease, pernicious anemia. Or if the scenario of skin rash and dizziness, so may be associated, vitiligo associated with Addison disease and pernicious anemia, or maybe celiac disease causing anemia, or diabetes mellitus. If skin rash and loss of weight, so you have to think about other autoimmune disease associated with vitiligo like Addison disease, pernicious anemia making malabsorption, and they can also celiac disease causing malabsorption. If skin rash with loss of consciousness, so you have to think about vitiligo associated with other autoimmune disease like diabetes mellitus, like Addison disease. So what he wants from you from vitiligo is not only to diagnose a case of vitiligo, because it is very easy to diagnose vitiligo, but just to explore other associated autoimmune diseases with it. So in vitiligo, you have to take history of the skin rash, and it is fixed history for all skin rashes, and then to explore and to ask about the history of all other autoimmune diseases with vitiligo, and that we are going to make it easy for you. We are going to divide the autoimmune diseases associated with vitiligo in a way which will make it so easy to approach. We'll start with the history, of course. If you are going to the station, you have to shake hands with the patient and introduce yourself, confirm the patient identity and confirm agenda of meeting, and start your station by asking about the onset of skin rash, course, duration, progression, site of the rash, and you can ask the patient, can I see the rash please, can you show me the rash? And of course you have the right to examine the patient even in the beginning of the station. Worsening factor of the rash, and you can name it by name, like trauma, stress, exposure to sun, smoking, alcohol or drugs. Any improving factor or any factors or anything improve your rash. Is it painful at all? Is it oozing? Or any secretions coming out? Is it blenchable? Is it itchy? Actually, this is a fixed scenario or fixed history to be taken for any skin rash. When this skin rash started exactly, is it increasing, decreasing, or the same? Is it coming on and off or all the time with you? Where is the rash in your body? Can you show me please? And you can inspect the rash in the patient. Do you notice anything that worsens the skin rash, like exposure to sun, stress, trauma, smoking, alcohol intake? Do you notice anything that improve this rash? Is it painful at all? Any secretions coming out? Is it blenchable? Of course, you are acting only. You know that this is vitiligo. It is very clear. This is well circumscribed patches, milky white patches. So just you are doing this routine, asking a routine history about the skin rash. Then you have to ask about all other associated autoimmune diseases for the patient. We'll divide it into endocrinal autoimmune diseases, rheumatological autoimmune diseases, and the gastrointestinal autoimmune diseases, plus alopecia. We know that vitiligo can be a part of polyglandular autoimmune disease type 1 or type 2, which is associated with multiple and a lot of autoimmune diseases. So here the endocrinal autoimmune diseases, we have multiple endocrinal autoimmune diseases. The form of hyperthyroidism for Graves', hypothyroidism in Hashimoto's, thyroiditis, hyperparathyroidism, diabetes, and hypertension. So for hyperthyroidism, you have to ask about hot intolerance, any anxiety, sweating, shaking of the hands, increased appetite, racing of heartbeats, loss of weight, loose motions for hypothyroidism, any weight gain, fatigue, bad mood, dry skin, irregular or heavy cycles for hyperparathyroidism, any muscle cramps or constipation for diabetes, any history of diabetes, if no, any history of increased thirst or increased appetite or increased urine frequency for Addison, any disease spells, especially with the changing your position from supine to erect position for postural hypotension of Addison, any loss of weight, any tender skin. Like that, we finish the endocrinal autoimmune diseases. Then rheumatological autoimmune diseases. We have SLE, rheumatoid arthritis, systemic sclerosis, and Sjogren may be associated with vitiligo. So in SLE, we have to ask about any joint pain, any facial rash increased with sun exposure, any falling of hair, any mouth sores, any frozen urine as well. For rheumatoid arthritis, any joint pain, but you asked about before, so no need to ask again. Any shortness of breath, finger color changes when exposed to cold weather, Raynaud's phenomena of rheumatoid arthritis or systemic sclerosis, any tight skin, difficulty with swallowing, finger color changes in cold weather as well, but you asked it before, rheumatoid, no need to ask again. Shortness of breath or pulmonary fibrosis or systemic sclerosis, but you asked about it before, no need to repeat again. For Sjogren, any dry mouth or gritty sensation of the eyes. Now we finish rheumatoid autoimmune diseases. We are going now to check or ask about gastrointestinal autoimmune diseases. For primary sclerosing cholangitis, primary biliary cirrhosis, celiac disease, autoimmune hepatitis, all can be associated with vitiligo. So we have to ask about any tummy pain, any discoloration of the eyeballs, any loose motions for pernicious anemia, any pallor than before, dizziness, fatigue, pins and needles in both hands, and for alopecia, any falling of hair. Now we covered all the autoimmune diseases can be associated with vitiligo. Then the social history, which is fixed for all the cases of station 5, station 2, and station 4. 4 question: what do you do for living, and how much the symptoms impact your job and usual daily activities? And you have to refer the patient to social worker if the patient has any social troubles related to his illness. And you have to refer the patient to occupational health care if he has any work troubles related to his illness as well, with whom the patient is living, and who is supporting him at home, financial support, smoke and alcohol history, any medical history of long-standing disease, any family history of similar condition or long-standing disease. Can you tell me about your drug list, please? Now you finished all the history about vitiligo, and in this stage of social history you can start your examination, not to waste time because time is very limited in station 5. Examination, focus examination for case of vitiligo. In vitiligo, we have first to see the vitiligo rash or the skin rash of the patient. You take permission of the patient to examine him, and then examine and see and inspect for the depigmented patches and its distribution all over the body. Then you have to examine for other associated autoimmune diseases. We'll start with the hand examination. Why? For finger prick marks of diabetes mellitus, for signs of polyarthropathy of rheumatoid and SLE, the pulse, of course, for hypo or hyperthyroidism, tachycardia. Examine palmar creases of the hands. We are still in the hands. Examine the palmar creases and the mucosa of the oral cavity by a torch for hyperpigmentation of Addison. And ask the examiner, I'd like to measure this patient blood pressure in erect and supine position for Addison as well. For pernicious anemia, you can examine the eye for conjunctiva of the eye for pallor, and the eye sclera for jaundice of autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis. And you can take permission of the examiner, I'd like to examine this patient abdomen as well for any organomegaly associated with because of autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis. You can take permission to examine the abdomen. The examiner, of course, will not give you permission for that because there is no time. Now we are going to explore the concerns of the patient. What are the most common concerns asked in this case? If the patient asked, what could be the skin rash, doctor? So at that time, your reply will be, most probably you have a case or a diagnosis or a condition called vitiligo. It is due to disturbance in your defensive system which is supposed to attack the bugs and protect the body. In your condition, the defensive system attacks the pigment layer in your skin, resulting in the milky white discoloration of your skin. It may be associated also with other diseases. So what we are going to do for you is to do for you first a blood test to exclude other associated diseases, and then to refer you to a multidisciplinary team. Of course, the patient will has another disease or another autoimmune disease with vitiligo, so you have to refer the patient to a multidisciplinary team from a skin doctor or a gland doctor or whatever, according to the diagnosis, to give you the proper and full plan of treatment. Okay, if the case is Addison associated with vitiligo, for example, the patient is complaining of dizziness or dizzy spells or loss of consciousness, whatever, and he has positive data of Addison disease or positive symptoms of Addison disease and signs, so most probably you have disturbance in your defensive system which is supposed to attack the bugs and protect your body. In your condition, it attacks your skin and the gland located above your kidneys, leading to deficiency of one of the most important hormones in your body called cortisol, which leads to some symptoms of hypotension, dizzy spells, loss of weight, getting or feeling sick, and electrolyte disturbance. So what we are going to do for you is to do for you first a blood test to confirm our diagnosis, then to refer you to a multidisciplinary team to give you the proper plan of management. Okay, so now, is it serious condition, doctor? If the patient asked you, is this condition serious, doctor? I'm sorry to tell you that it is serious condition if untreated, but it can be controlled if you are completely compliant on your medications. It's important to wear medical alert bracelet in your wrist to make the others know about your condition, and to carry one ampoule of cortisone to be given if necessary. So these 2 points is important to mention for a patient with Addison disease, that he has to wear medical alert bracelet to make the others to know about his condition, and also to carry one ampoule of steroid or cortisone to be given if necessary in emergency cases. So what if the case is pernicious anemia? The patient, for example, has dizziness or pallor or anemia, and they have signs of pernicious anemia and symptoms of pernicious anemia. How to reply this concern? Most probably you have disturbance in your defensive system, which is supposed to attack the bugs and the bacteria and defend your body. In your condition, it attacks your skin and the lining of your stomach, leading to destruction of the lining and malabsorption of nutrients like iron, vitamin B12, folic acid, leading to anemia and dizziness. So what we are going to do for you is to do for you further blood test to confirm our diagnosis, and then to refer you to a multidisciplinary team from a gland doctor and gut physician or bowel physician to give you the proper care and plan of management. What about exposure to sun, doctor? If the patient is vitiligo, of course, exposure to sun exaggerate and worsen the condition of vitiligo. So you have to inform him exposure to sun worsen your condition, unfortunately. So it's advised to apply sunscreen when you are going outside. The examiner can ask you some questions related to the case. What's your differential diagnosis of hypopigmented skin rash, doctor, or vitiligo? So we have multiple differential diagnoses of hypopigmentation or hypopigmented skin rash, like pityriasis versicolor, pityriasis alba, leprosy, lichen sclerosis, morphea. These are enough to mention, just 3 or 4 differential diagnoses. Okay, what you are going to do for this patient, doctor, or how to manage this patient? Okay, so or how to investigate first this patient according to the given data, or according to the positive data and the symptoms and signs. For example, if the patient has Addison disease, so you have to make basic investigation in the form of CBC lights, kidney function, liver function, and electrolytes, and to do specific investigation in the form of short synectine test. If the patient you are suspecting pernicious anemia, so you have to do also basic investigation in the form of CBC, electrolytes, kidney function, liver function, and autoimmune profile of pernicious anemia. So the target or your investigations will be according to the positive data and according to what you are suspecting as other associated autoimmune disease. How to manage this patient, doctor, or treatment for this patient? The form of non-pharmacological treatment, patient education and counseling, psychosocial support, occupational support, and specific treatment in the form of treatment of skin rash, applying for sunscreens and the cosmetic camouflage, medical treatment in the form of steroids, topical and systemic, topical tacrolimus cream, and the photochemotherapy. Okay. In some cases, we can do also surgical therapy like punch grafts and mini grafts in a case of vitiligo in the skin itself. And you have to treat also the associated disease For pernicious anemia, for example, you have to give the patient vitamin folic acid and vitamin B12 as replacement. And of course, don't forget referral for multidisciplinary team. If the patient has Addison, you have to treat Addison in the form of in acute attacks and in chronic or in the long run. In acute attacks, he is given IV fluids and IV hydrocortisone and electrolyte correction. And in the long run, we can give him replacement therapy in the form of hydrocortisone and the fluorocortisone. So this is a case of vitiligo, which is a common case in the exam. So in vitiligo, don't forget the other associated autoimmune diseases, which is coming frequently in station 5. I hope you get benefit and see you inshallah in the next cases. Thanks.